Are you wondering if you can permanently cure eczema without using medications? Maybe you're using topical steroids and things like this, or maybe you're just suffering with eczema all the time and don't want to use medications. My name is Dr. Terranella, and in this video, we're going to discuss some of the things that I use to help people permanently cure their eczema without using medications, some dietary things, and some sequencing of how to go about treating eczema without using medications. If this interests you, keep watching. We're going to get into the details. We're all about helping you gain a deeper understanding of your health and what's going on with your body. Hopefully this video gets you a little bit closer towards that aim. I also wanted to point out that sometimes when I'm producing this content, I get a statistic wrong or the name of something wrong, and almost always there's a corresponding blog article on our website, SW Integrated Medicine /blog. You can find it there. Those oftentimes go into a little bit more detail than the videos do as well. So please check that out if you're interested. And it does take considerable effort to produce this content. So if you're liking the information, please click on the like button and subscribe to the channel. If you do have questions about any of the content, please ask it in the comment section here or on the blog. That's why I'm producing the information, for you to gain that deeper understanding. So ask the questions if you have them. Hope you enjoy the video. Thank you for watching. Let's get into it. Can you permanently cure eczema without medications? The short answer is yes, you can. Now you're probably wondering, how do you do this and what does it take and all that? Well, I've personally helped many people permanently cure their eczema without using medications, and it doesn't come back. Sure, they may have flare-ups here and there depending on certain circumstances, but it's a very reliable approach is to, like with many skin-related issues, is to treat the gut or treat your digestion. So for those of you who already know you have digestive issues, hang in there. I'll circle back to what to actually do about it. But for those of you who have eczema and don't think you have digestive issues, you need to pay closer attention. Many times people with eczema and skin-related issues, they do that have digestive problems. They may not be, very obvious, but if you pay closer attention, you'll start to see that there are patterns and disruptions in your digestion. That's been my experience in helping many patients with this, is as they start to pay closer attention to their digestion, their skin issues seem to be correlated with their digestion. Now with skin, it takes several weeks or even months for things to turn over to the point where you can actually see a change and improvement. So you may not notice from one meal or one day to the next, but if you stay consistent with what you're doing, you'll start to see the changes over time, over weeks or months. So that's important. But back to recognizing that you do have a digestive issue. So you want to look at what is normal, what is abnormal, and normal. So for that, you want to look at frequency and consistency. So frequency-wise, 1 to 2 bowel movements per day is considered normal, and any less than that would be abnormal. More than that potentially could be 3 might still be okay. Then you would go more towards, okay, what's the consistency like? So consistency wise, it should be formed and not breaking up and dissolving, and it also shouldn't be really hard pebble like. So it should look like a tree that was recently cut down, so it has a nice form to it, versus a tree that's been decaying in the woods for 3 to 4 years. Have that kind of breaking up sort of look to it. So that would be abnormal. And and then you also want to look at, okay, how often is it more of the normal versus the abnormal? Is it 90% of the time it's normal? Maybe you don't have an issue. If it's 50-50, that sounds like kind of an issue there. So those are some of the things to think about is, do you have the normal consistency, and are you going regularly the way you should? If not, then we want to look at what sort of things could be going on with the digestion. So now we're going to look at what to actually do about eczema in the sense of treating the gut. So what to do to permanently cure eczema without medications. So if you found that you actually do not have any digestive system issues, as far as you can tell, you may want to dig into that even further and do some testing, some specialty lab testing. But I'm going to leave that for maybe another video or another time. For the folks that already know they have some digestive issues, in a previous video with eczema, we talked about how the immune cells of the innate immune system are being activated by food particles and microbial toxins from having leaky gut or inflammation in the digestive tract. So with this in mind, the first thing you want to be doing is to treat the gut and calm down this activation of the innate immune system, this overactivation and stimulation, because those immune cells and those microbial toxins and or food particles are getting distributed throughout the body and in the lymphatic tissue and showing up on the skin and further inflaming the immune system sitting underneath your skin. So let's put this into some categories so you can kind of look at how to approach it. So when you have eczema and other skin issues, but eczema specifically, there's no doubt that you do have leaky gut, and this should be treated. But I believe it's important to recognize, where each person is going to be a little bit different. There's no one size fits all treatment approach for eczema and digestive issues, for that matter. But a lot of people do have leaky gut, and there's a lot of talk about treat leaky gut, and here's 10 supplements or 10 nutrients to take. You want to make sure you're sequencing those things in the right order, paying attention to symptoms and using them in the right sequence. So, and there's different ways to do that as you progress through your treatment. You can see some of my previous videos on leaky gut if you want more details on this, but we're not going to go into so much on the leaky gut just yet. So the first step, as I said, for everyone is to calm down the inflammation that's causing the leaky gut. The most common of which are microbial toxins, like I said, so bacterial overgrowth, fungal overgrowth, some sort of dysbiosis or imbalance in your microbiome. It doesn't necessarily have to be in the small intestine, but some sort of microbial issue, food intolerances, and sometimes those two things go together, and then histamine excess. These are kind of the three important things to be paying attention to when you have eczema. Many times, like I said, people do have this microbial or fungal overgrowth, and if you treat this, if you go in really strong with a treatment like this, a lot of times the eczema will get a lot worse because you're dumping a lot of those microbial toxins. You're killing the bacterial cell walls, and those are getting into your system systemically. So you have to go approach this being aware that things may get worse before they get better. So, and because of that, a lot of times it makes more sense to approach the dietary aspect of this first before going in with using some antimicrobial. So what kind of dietary things can you do to help permanently cure your eczema or start reducing some of the flare-ups and things like that? So a lot of times people will do like elimination diet or AIP protocol type of diet. These types of diets are removing a lot of the common food triggers that are triggering the innate immune system or the immune system in general, depending on how long you've had the eczema for. There's a lot of overlap between those two types of diets, and the reason that they're working is they're helping you're reducing the food particles that are pro-inflammatory, but you're also reducing the amount of some of the foods that are on that list are reducing the amount of microbial growth and therefore reducing the microbial toxins that are being produced from those foods. So along those lines too, like a low FODMAP diet can also help start to calm things down in the case that you're kind of doing this first before you do antimicrobials. Sometimes just eliminating gluten and dairy can also make a big difference for the eczema. So the thing is, doing this alone may seem to cure your eczema or reduce the eczema. For some people, it may completely go away just by eliminating dairy products, for instance, or eliminating gluten, and that's fine. That's really good if that's the only thing you need to do. But you have to remember that a lot of times there is microbial imbalances there, and you have to remember to go back and treat this, and especially in the sense that you're eliminating 10 or 5 different food groups, and then you're still having symptoms even though you've eliminated those, and you're still getting eczema. That typically means there's still something going on, some piece you're missing. So you want to remember, maybe you do have to go back and treat the microbial overgrowth, and then also make sure you're going back and treating a leaky gut once you remove the inflammatory culprit. So keep that in mind as you're kind of moving along, and also, it's not always a clean progression of, removing the foods, treating the leaky gut, and then everything's fine. You have to be paying attention to, how often you're getting flare-ups, and it should be getting better in a linear fashion. But if it doesn't go completely away, most of the time you're missing something. It's likely that there's some microbial imbalance there that hasn't been taken care of, or there's some piece of the leaky gut picture that hasn't been taken care of. And that's when we would go in and do some kind of testing to make sure there's no microbes present, whether it's a blood test or a stool test or some kind of leaky gut test, to kind of look at what's going on with the cells of the digestive tract, to see if there's possibly some leakiness occurring there. So that's all I had for this video. Can eczema be permanently cured without medications? Hopefully that gives you a better idea of some of the things that I do when I'm treating people with skin issues and eczema specifically, to help make sure they're permanently resolving these skin issues so they don't come back. If you like the video, please click on the like button and subscribe to the channel. Thank you for watching. We will see you next time.